Sashi, and I will be taking you through session 3. Now, from session 3 onwards, in this whole subject, what we'll be doing is following the same pattern as session 3. So what we'll be looking at is a particular system of the body. For example, in this session, we are looking at the nervous system. What we'll be doing is doing a very quick revision of the anatomy and physiology of the system studied, followed by homeopathic remedies, which are quite specific and important in their sphere of action within this system, like the nervous system or the musculoskeletal system. And to end the session, what we'll be doing is giving you some clinical tips, actually practical, solutions or potency selection or, basically clinical tips, and how to go about prescribing for conditions of the system. Okay, so let's get started. Now, remember that in homeopathic literature, you have a lot of successful cases pertaining to the nervous system, or also severe chronic pathological conditions. Remember that our role as a homeopath today in many of these conditions, whether it be neurological conditions or other severe pathology, it is not to cure, but to help people cope better with their difficulties. And what we are advising for is a multimodality treatment approach, rather than homeopathy being the standalone in such conditions. Although the literature says that. So this is a word of caution which I'd like you to keep in mind. Don't go to your patient and say, oh, I can cure this, I can cure that. No. We are there only as support. We are not primary caregivers in such situations. Okay. Now, let's move on to the anatomy physiology of the nervous system. Nervous system, as you know, is one of the two systems, along with endocrinology or the endocrine system, which actually integrates all the workings of the body, like the cell, the tissues, the organs. All of them come together or integrated by the nervous system and the endocrine system. Now, the nervous system consists of the central nervous system and the peripheral nervous system. The central nervous system consists of the brain, which is protected by the skull, and it contains 100 billion neurons, neuron being the basic unit of the nervous system. And from the brain, you have the 12 pairs of cranial nerves which exit from the base of the brain. Now, the peripheral nervous system consists of let's just go back to the central nervous system. Let's finish that before we move on to the peripheral nervous system. The central nervous system, I've just spoken to you about the brain. We also have the spinal cord, which I've forgotten to talk to you about. So we have the central nervous system, which consists of the brain and the spinal cord. The brain, I've already spoken to you. The spinal cord is protected by the vertebrae, and it's got around 31 pairs of spinal nerves which exit from the vertebral column, which is composed of 100 million neurons. And now let's move on to the peripheral nervous system. Now, the peripheral nervous system consists of the somatic nervous system. Now, the somatic nervous system consists of the sensory and the motor neurons. And the peripheral nervous system also consists of the autonomic nervous system. The autonomic nervous system is further divided into the parasympathetic and the sympathetic. And the peripheral nervous system also consists of the enteric nervous system, which is what you find in the digestive tract. Now, the basic unit of the nervous system is the neuron, right? Now, the neuron consists, the nervous tissue basically consists of two types of cells. One is the neuron, which is the basic information processing unit. Yeah? And the second type of cell is the neuroglia. Now the neuroglia is what is supports, nourishes and protects the neurons. Okay. Now the main function of the neuron is to basically to conduct the sensation. So what is a sensation? Sensation is either the conscious or the subconscious awareness of the changes in the environment, whether it be external environment like heat, light, pressure, etc., or it may be the internal environment which we are not conscious of. So sensation is the awareness of these changes, and once this awareness is there, this awareness is picked up by the neurons. Okay, so this is what we call as the stimulation, the sensory stimulation. And this stimulation is carried by the sensory nerves to the brain or the spinal cord, and the information on what needs to be done is conveyed from the brain and the spinal cord through the motor nerves to the what we call as the effectors. Effectors may be a muscle, or it could be the skin. It could be any one of those effectors. That means which does that response to the sensory stimulus. Okay, so this whole thing of stimulation, sensory nerve, brain or spinal cord, motor neuron and effector, this is called as the nerve conduction. Yeah, this whole thing. Now, how quick is this conduction taking place? This is dependent on the diameter of the axon. Okay, and also whether the axon is covered by the myelin sheath or not. The axons with larger diameters will conduct the nerve impulse quicker. The axons with myelin sheaths will also conduct the information much faster than an unmyelinated axons. Okay, and axons also conduct the information at higher speeds when warm, and when it's cold, it's the pace of it slows down. Now, the junction between one neuron and another is called as a synapse. Okay, and that's where the information is passed from one neuron to the other. It's a functional junction between two neurons. Or it could also be between a neuron and a effector. Okay. Now, let's have a look at some of the common neurological diagnostic factors. So, if somebody has got some kind of a neurological disorder, what are the things that you're going to be looking at? Level of consciousness. Whether they appear confused, whether they can talk clearly, whether they can answer your questions, whether there is memory loss, and also whether they are responsive to stimuli. And also motor dysfunction. Okay, whether there is paralysis or if there is too much of stimulation, like you could have, spasms, hyperreflexia. Sensory deficits would be changes in temperature, touch, pain, all that, where they cannot feel it. Yeah. Visual loss is another common neurological diagnostic factor. Same with language problems. Yet the speech may be slurred. Some of the conditions that you can see would be seizures or convulsions arising out of neurological problems. You can also have headaches. You can also have effects of this. Can also be increased cranial pressure, intracranial pressure because of some tumor or hemorrhage or infection. You could also have that. Yeah. So these are the main common neurological diagnostic factors. Now, neurological symptoms, what are they? How would the patient describe something happening? Yeah, the main a description of pain when you're doing a case taking would be, they would tell you that the pain is sharp, shooting, or tingling, numbness, prickling, yeah, and usually like an electric shock kind of a pain, yeah. So, and remember, in neurological conditions, it's also important to find out, you know, whether the pain is a referred pain or the seat of the pain is that place where the patient is actually pointing to, yeah. Because sometimes you can also have pain, what we call as referred pain, like the site of injury may be one place, but the pain is, they feel the pain in a different place. And with neurological conditions, pain in a part of the body fairly remote from the tissue causing the pain is quite common. Okay? And Morrison says that many of our most important results in homeopathy come in incurable neurological disorders, especially when the illness is caused by inflammation of nerve tissue. Okay, so what are the common neurological conditions that you can think of? Headaches and migraines, major, back pain, fainting, epilepsy, and the more, more severe pathology like CVA or the cerebrovascular accident, MS, Bell's palsy, chorea, Parkinson's disease, etc. Now, we've talked about, on the one hand, Morrison and the ancient literature in homeopathy telling us about how successful homeopathy can be in the treatment of conditions like, say, chorea and, other neurological conditions. So, is there any research to back this up? Yes and no. Okay, remember that homeopathy and research, we have very few well-conducted research, although there's a huge amount of it now coming in. But for single conditions, it's quite difficult to do because of the individualization aspect of homeopathy. Yeah, there are a few. One of them is this randomized, double-blind, placebo-controlled, individualized clinical trial of mild traumatic brain injury, which was done in 60 patients. Yeah, and this shows that, which got a good result, and this study shows that homeopathy might have a place in the treatment of brain injuries. Considering it's only 60 patients that were that research was done on, we do need a large-scale independent replication of this. Yeah. Now, another research that was done was a survey, which was a cross-sectional survey of patients and families attending the Alberta in Canada Children's Hospital Neurology Clinic. Yeah. And they took children between the ages of 2 to 18 with a known neurological illness. Yeah, and this was a survey done, and 44% of the patients surveyed had used CAM, that is the complementary therapy, in addition to whatever was the conventional treatment being given. And out of these patients, 44% of the patients who had used CAM therapy, they were 59% of them reported having benefits after using CAM. However, out of the 44% which had used CAM, only 8% had used homeopathy. And unfortunately, there's no differentiation between which one of the CAM therapies that they'd used was more effective. Yeah, it's just that this research just shows that we need more research in CAM. We need more money into research in all our CAM therapies. Okay, now this is another research which is with trigeminal neuralgia. Okay, now 15 patients where the physician confirmed, that means there's a positive diagnosis of trigeminal neuralgia, they received individualized homeopathic treatment. Now, remember, research involving individualized homeopathic treatment generally gets a very good result. It's when we have to do like non-individualized homeopathic treatment that our research falls. Yeah, so this being individualized homeopathic medicine, there was a statistically significant where the P was 0.001. Okay, so that means it's a very good result showing that more than 60% reduction in the pain intensity and attack frequency, indicating that homeopathy could be an effective and safe method in trigeminal neuralgia. And this is something that once you start practicing homeopathy, you will see very good results in trigeminal neuralgia. Is one of the conditions which even in my clinic I got a good response to. Now, another good research present is the randomized, double-blind, placebo-controlled clinical trial to study migraine, the effectiveness of homeopathy in migraine. Okay, there were 73 patients, they were randomized, and 68 actually completed the trial, and based on that, 4-month treatment with individualized medicine or placebo were given with a statistically non-significant difference favoring homeopathy. Okay, now when you have something like that, yeah, there was a reduction in the frequency in the homeopathy group, which was where the P was 0.04%. Not percent, sorry, 0.04. Yeah, but the non-statistically significant trends were in favor of homeopathy for pain intensity and for overall evaluation. So this research shows us that you need a better or improved trial design. Okay, and using homeopathy as a prophylaxis is what needs to be the next step going from this research.